Morning, everyone. Today's lecture is about antifungal drugs. To start with, antifungal drugs are a group of drugs that are used to combat fungal infections, and they work on eukaryotes. Uh, if you remember the lectures of microbiology, um, prokaryotes present the bacteria, while eukaryotes represent different kinds of cells that include the human cells and include the fungal cells. The fungal cells are eukaryotic cells, and so the classification according to the route of administration of these antifungal drugs, they are either for systemic fungal infections like that in the CNS or in the liver, or topical. Topical means usually on the skin or inside the GIT. Inside the GIT, this is called for topical use. The systemically used drugs are Griseofulvin, Amphotericin B, ketoconazole, fluconazole, and terbinafine. While for topical use, they are divided into those used for treatment of candidiasis. What is candidiasis? Candidiasis is fungal infection caused by yeast. It's a type of fungus called candida. هذا المفروض تماخذي بالميكروبيولوجي. These drugs used for candidiasis هي الجماعة الimidazoles including ketoconazole, miconazole, triazoles including terconazole, and choline macrolides including nystatin, amphotericin B, and others like gentian violet. gentian violet هذا فد drug يعني قديم نسبيا. It has antifungal and antibacterial effects. Then dermatophytes, هذا الاستعمال الثاني للtopical topical use of these drugs. And dermatophytes, fungal infection of skin. Dermatophytosis يقصد به infection of hair or skin or nails caused by dermatophyte. Dermatophyte هو most commonly of Trachophyton genus. هذا فد نوع من الفنجاي. And less commonly of the Microsporum or Epidermophyton genera. المثال عليها هي Tinea capitis, هذه infection of the head. Tinea pedis, infection of the foot. And onychomycosis يعني infection of the nail. They are common fungal disease. فهنا الدراجز المستعملة في حالات عياعات الاستكوالين oxidase inhibitors which include terbinafine, naftifine, and tolnaptat. In addition to Whitefield ointment اللي هو مكون من 12% benzoic acid and 6% salicylic acid. Now we come to these drugs in detail. First we have the Amphotericin B. It's poorly absorbed from GIT and given orally because it's effective for fungal infections of gastrointestinal tract. احنا صحيح اللي نعطيه orally لكنه هو it's poorly absorbed. It has يعني systemic effect ماله ضعيف. إذا أريد يعني أعطيه orally ما يحصل good absorption. فهنا راح يصير effect مالته تقريبا mainly it is inside GIT, so it's a kind of topical effect. موضعي. إذا تريد تحصل good systemic effect for systemic infections مثلا infections of the liver مثلا as we said before, it should be given by slow IV infusion. أيضا عندنا مشكلة ثانية مع أنه it crosses the blood-brain barrier poorly and thus should be given intrathecally to treat fungal meningitis. ما يفيد تعطيه IV for fungal meningitis, you should give intrathecally. بعد اكو استعمالات اخرى ايضا الفنجل arthritis. هنا it should be given locally inside the joint, local injection into the joint to treat fungal arthritis. It is metabolized in the liver and excreted in urine. It works by disrupting fungal cell membrane, forming pores, so it alters the permeability and causing leakage of intracellular macromolecules and thus cell death. الادverse effects اكو immediate reactions إذا أعطيناه عن طريق الانفيوجن. Infusion related toxicity causes fever, chills, muscle spasm, vomiting, headache, and hypotension. There is also slower or cumulative toxicity. هذه most serious is renal toxicity, nearly in all patients, and sometimes may be irreversible. يؤدي إلى مشاكل في الإلكترولايتس من ناحية الهايبوكاليميا والهايبومغنيسيميا, impaired liver function, sometimes anemia. The clinical use, as we said, it has a broad spectrum activity. It's a drug of choice for life-threatening mycotic infections. يعني drug مهم في علاج يعني life-threatening fungal infections, and also it's used for preventive therapy of relapse. نجينا الآن للنستاتين, very commonly used drug. It's too toxic for systemic use, thus used only topically. It's available as creams, ointments, suppositories, and other preparations. It's not significant, as we said, not significantly absorbed from skin, mucous membranes, or GIT, and the oral preparations act locally in the GIT. أيضا استعمال موضعي, حتى إذا أعطيته عن طريق الفم هو الاستعمال موضعي GIT infections. For clinical uses, candidiasis of the mouth, ما يسمى بالoral thrush. هذا very common in neonates, بالأطفال. الأطفال يعني جو السنة يسألهم نوع من خاصة حديث الولادة يعني يسألهم نوع من infection in the mouth على شكل بقع بيضاء, بقع بيضاء, وهذه يعني علاجها البيست تريتمنت هو النستاتين. ممكن هاي الكاندياسيس can include the esophagus and lower intestinal tract. Sometimes it may cause vaginal candidiasis, يعني حتى يحصل يعني بالadult females. Mechanism of action, it's like Amphotericin B, it forms pores in the cell membrane leading to fungicidal effect. The adverse effects are diarrhea, abdominal pain if taken orally, hypersensitivity reactions may happen, rarely bronchospasm and tachycardia. Azoles, these are a group of synthetic fungistatic agents with a broad spectrum of activity, and they have antibacterial, antiprotozoal, antihelminthic, and antifungal activity. So the mechanism of action include the inhibition of fungal cytochrome P450 enzyme, alpha D methylase, which is responsible for converting llanosterol to ergosterol. هذا الارجوستيرول هو important ingredient of the cell membrane. ف يعني inhibition of this enzyme راح يؤدي لأنه cell membrane ما راح يتكون بشكل صحيح. Second, inhibition of mitochondrial cytochrome oxidase, and thus will lead to accumulation of peroxides and auto-digestion of the fungus. Imidazoles هذه نوع من الازول عفوا. imidazole وتريازول. فالimidazole may alter RNA and DNA metabolism. Now we come to the azoles. They are classified into imidazole and triazole group. As we said before, the imidazole include ketoconazole, miconazole, and clotrimazole. الكيتوكونازول it's well absorbed orally. هو طبعا very commonly used على الكيتوكونازول. Bioavailability is decreased with antacids, H2 blockers, proton pump inhibitors, and food, and doesn't cross the blood-brain barrier. So it is used topically or systematically for oral by oral route only. By oral route only. To get systemic effect to treat oral and vaginal candidiasis, dermatophytosis, or systemic mycosis. The adverse effects include hepatotoxic effects and inhibits human cytochrome B 450 enzymes. احنا قلنا هو بالميكانيزم اوف اكشن هو يشتغل على يعني على يسموها بالسلايد fungal cytochrome B 450. لكن هو يعني هذا الإفكت مالته not very specific for this enzyme. It may affect the human P450 enzymes. بعد inhibit adrenal and gonadal steroids leading to يأثر على الميتابوليزم of adrenal and gonadal steroids leading to menstrual irregularities, loss of libido, impotence, and gynecomastia in males. ففي مشاكل كثيرة هذا الدرug. It's contraindicated in pregnancy, lactation, and hepatic dysfunction. The interactions include كما ذكرنا قبل قليل أن proton pump inhibitors و H2 blockers و antacids decrease its absorption. عدة في الانتراكشن ويا الريفامبيسين and phenytoin. These drugs decrease ketoconazole levels, and ketoconazole increase cyclosporin, warfarin, and corticosteroid and theophylline levels. ليش؟ لأنه هو enzymatic inhibitor، وبذلك يؤدي إلى ارتفاع مستوى هذه drugs. Now we come to the triazoles اللي هي تشمل الفلوكونازول والإتراكونازول والفوريكونازول. They are causing less endocrine disturbance as compared with ketoconazole. يعني هنا تأثيرهم على الاندوكراين ضعيف نسبيا. الفلوكونازول is water soluble drug, completely absorbed from GIT, and the bioavailability is not affected by food or gastric pH. The drug interactions are less common and it penetrates blood-brain barrier well, so it is the drug of choice in cryptococcal meningitis. في clinical uses يستعمل بالcandidiasis, cryptococcal meningitis, histoplasmosis, plastomycosis, ringworm, but it's not effective in aspergillosis. هذا نوع من الفانجل infection يعني فهل نوع بالذات it's not effective for treatment. The side effects include nausea, vomiting, headache, skin rash, diarrhea, abdominal pain, reversible alopecia, Hepatic failure may happen, may lead to death. It's highly teratogenic as other azoles and but no endocrine side effects. Flucytosine هذا it's water soluble pyrimidine analog from fluorouracil جروب 5 فلورايوراسيل يمكن إذا تذكروا ماخذيه بالكيموثيرابي as a cytotoxic. It's anti-metabolite, cytotoxic drug. It's often given in combination with amphotericin B and itraconazole. It is systemically fungistatic and it has narrow spectrum effect. It works by conversion within the fungal cell to 5-fluorouracil. يتحول إلى 5-fluorouracil but not in human cell. That inhibits thymidylate synthetase enzyme that inhibits DNA synthesis. Amphotericin B increases the cell permeability, allowing more 5-fluorocytosine to penetrate the cell, and they are synergistic. عندهم synergistic effect الفلوسيتوسين والأمفوتيريسين B. Pharmacokinetics is rapidly and well absorbed orally. It's available only in oral formulations and is widely distributed, including the CSF. The clinical use severe deep fungal infections as in meningitis, generally given in combination with other agents for synergism and to reduce resistance. في الفترة الأخيرة بدأت تظهر resistance حتى في الفنجاي، يعني بدأت تظهر بعض السلالات من مثلا الكانديدا أورس بدأت تظهر مالتي دراج ريزيستنت كانديدا أورس. فبالفترة الأخيرة بدأنا نفكر في استعمال several drugs for the treatment of fungal infections. مثال عليها الكريبتوكوكال meningitis in AIDS patients. Nausea, it causes nausea, vomiting, diarrhea, severe enterocolitis, reversible neutropenia, thrombocytopenia, and bone marrow depression, in addition to alopecia. Now we come to the Griseofulvin. هذا أيضا drug مهم commonly used. It's fungistatic and has narrow spectrum. Given orally, its absorption is better with fatty meal. It induces cytochrome P450 enzymes. Griseofulvin inhibits fungal mitosis by interfering with microtubule function, used to treat dermatophyte infections, سواء كانت ringworm of the skin or hair or nail. It's highly effective in athlete's foot. athlete's foot ما يسمى بالتينيا بيدس، نوع من الفنجل انفكشن يحصل في الفوت خاصة عند الرياضيين. It's ineffective topically and not effective in subcutaneous or deep mycosis. Adverse effects include peripheral neuritis, mental confusion, vertigo, and blurred vision. التولنفتات هذا أيضا drug مهم. It's effective in most cutaneous mycosis. It's ineffective against candida. It's used in tinea pedis, fungal otitis externa. As you can see in this image, هذه صورة مع الأوتوسكوب يعني ناظور الأذن حتى نشوف fungal infection of the ear. هذا يعني otitis externa, fungal otitis externa is common for those who are let's say swimmers، يعني يسبحون بكثرة ويروحون يوميا المسبح، فهذول يصير لهم fungal infection of the ear بتكون على شكل cheesy material, cheesy white material in the ear as you can see here. So it's treated by tall نفتات drops. اكو على ايضا على شكل كريم جel powder or topical solution. Terbinafine inhibits fungal squalene peroxidase and so decreases the synthesis of ergosterol. Accumulation of squalene, which is toxic to the organism, causing death of the fungal cell. It's typically used for candida albicans and dermatophytes and onychomycosis. As you can see here in this image, هذا تشوفون انه this infection of the nail by fungi يؤدي الى تكسر الاظافر وفد طبقه بيضاء عليها، هذا onychomycosis. فهنا the drug of choice is terbinafine. If given orally it's severely hepatotoxic. فهو يعني mostly هو يعني is used as يعني topical treatment. It accumulates in breast milk and should not be given to nursing mother. بالنهاية عندي بعض الملاحظات حول principles of antifungal therapy. أكو بعض الأشياء you should take care when you prescribe antifungal treatment. First of all, try to use topical therapy as much as possible. Try to use it as topical therapy and avoid systemic therapy unless it is essential. الانتيفانجل drugs بشكل عام السايد افكتس مالتها يعني when used systemically يعني مزعجة. They are يعني highly toxic drugs. يعني إذا قارنها بالانتيبايوتكس الانتيفانجل يعني they are highly toxic. فنحاول انه نتجنب الاستعمال السيستميك الا اذا كان يعني essential. هم نرجع هذا يذكرنا هو ليش يصير يعني high toxicity with antifungals because fungi are eukaryotes and human cells are eukaryotes. فاكو نوع من interaction، نوع من يعني الافكت مالتها يتعدى تاثير اليوكاريوتيك. التاثير مالتها مو كل شيء سبيسيفيك للفانجل سيلز، التاثير مالتها يتعدى الفانجل سيلز فيؤدي على ياثر على الهيومن سيلز بشكل كبير، وذلك تكون السايد افكتس مالتها نوعا ما مزعجه. مو مثل الانتيبايوتكس يعني ذيك تشتغل يعني مينلي على البروكاريوتس على البكتيريا. ثانيا you should boost immunity. هي الفانجل infections are very common in those with immune compromised conditions or disease. مثلا diabetes you should يعني control diabetes، تنزل السكر مالته تسيطر عليه بشكل جيد. عادة هاي الفانجل انفكشنز اللي ذكرناها هسه كلها common بالdiabetic patients, very common in diabetic patients and immunocompromised. You may stop the immunosuppressive therapy إذا هو كان يأخذ فد immunosuppressive drug. Improve nutrition. These diseases are common in malnutrition patients, and improve nutrition and hygiene. أيضا هي common in those اللي ما يهتمون بالنظافة، سواء كانت نظافة يعني جسمهم أو نظافة يعني السكن مالتهم. يعني شوف حتى في بيوتهم يشوف إنه العفن منتشر everywhere. بعد for skin infections try to maintain dry skin. واحدة من أهم الأشياء اللي تحفز نمو الفنجاي هي الهيوميديتي، الووتر، وجود الماء. مثال عليها مثل ما ذكرنا الفنجل اوتايتس اكسترنا ما يسمى بالسويمر اير. يعني الناس اللي يتعرضون للماء بكثرة بشكل يومي يعني هذول او يعيشون في اجواء رطبة، هذول يعني يكونون معرضين اكثر للاصابة بالفنجل سكين انفكشنز. فلذلك من أحد الأشياء اللي لازم المريض يحرص عليها إنه يعني يعالج السكين فانجل سكين انفكشنز، إنه يحافظ عليها على هذه المناطق المصابة جافة قدر الإمكان. Consider surgical resection of necrotic tissue if required. Sometimes يصير فد damage بالskin or يعني in certain areas of the body يكون damage يعني شديد نتيجة هاي fungal infection. So sometimes we may consider surgical removal of the dead tissue. And thank you for your listening, and I hope you enjoy the lecture. If you have any questions, you may ask on the Google Classroom or my email, and don't forget to register your attendance in the sheet of or form of attendance. Thank you.